Case study number 11. Summary. Jane Smith, a 65-year-old female. Jane presents with confusion, headache, and a high fever. She has a history of hypertension and type 2 diabetes. Current situation. Jane arrives at the emergency department with a sudden onset of confusion and a severe headache. Her daughter reports that she has had a fever for the past 2 days. Jane's vital signs are blood pressure, 160/95 of a millimeter of mercury, heart rate, 105 BPM respiratory rate, 22 breaths per minute temperature, 39.5 degrees Celsius, 103.1 degrees Fahrenheit, oxygen saturation, 96%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Bacterial meningitis. Meningitis is an inflammation of the protective membranes covering the brain and spinal cord, typically caused by bacterial infection. Pathophysiology includes the spread of bacteria to the meninges via the bloodstream, leading to an inflammatory response. Key points include rapid diagnosis and treatment to prevent severe complications such as brain damage and death. Answer B. Encephalitis. Encephalitis is inflammation of the brain, often due to viral infection. Pathophysiology involves the viral invasion of brain tissue, causing inflammation and neuronal damage. Important considerations include early antiviral treatment and supportive care to manage symptoms and prevent complications. Question 2. What immediate nursing care is required for this patient? Answer A. For bacterial meningitis, initiate droplet precautions to prevent the spread of infection. Administer antibiotics as prescribed and antipyretics for fever. Monitor vital signs and neurological status closely. Provide intravenous fluids to maintain hydration and blood pressure. Answer B. For encephalitis, administer antiviral medications if a viral cause is suspected. Provide supportive care, including antipyretics for fever and anticonvulsants if seizures occur. Monitor vital signs and neurological status closely. Maintain a quiet and comfortable environment to reduce stimulation. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer. Lumbar puncture, to obtain cerebrospinal fluid (CSF) for analysis to diagnose meningitis or encephalitis. Blood cultures, to identify the causative organism in the case of bacterial meningitis. CT or MRI of the brain, to assess for brain swelling, abscesses, or other abnormalities. Complete blood count (CBC), to evaluate for infection or inflammation. Elevated white blood cell count. Electrolyte panel, to assess for imbalances due to fever and infection. Blood glucose levels, to monitor glucose control in a diabetic patient. Renal function tests (BUN), creatinine, to assess kidney function, especially if contrast is to be used for imaging. Medication information. Antibiotics, for example, ceftriaxone, vancomycin, to treat bacterial infections. Considerations. Administer as prescribed, Monitor for effectiveness and side effects. Side effects: nausea, diarrhea, allergic reactions. Contraindications: known allergy to the antibiotic. Antivirals, for example, acyclovir, to treat viral infections. Considerations: administer as prescribed, monitor for effectiveness and side effects. Side effects: nausea, diarrhea, headache. Contraindications: known allergy to the antiviral. Antipyretics, for example, acetaminophen, ibuprofen, to reduce fever and relieve pain. Considerations: administer as prescribed, monitor temperature and pain levels. Educate the patient on the proper use of antipyretics. Side effects: liver damage acetaminophen, gastrointestinal upset ibuprofen. Contraindications: severe liver disease acetaminophen, peptic ulcer disease ibuprofen. Anticonvulsants, for example, levetiracetam, to prevent or control seizures. Considerations: administer as prescribed, monitor for effectiveness and side effects. Side effects: drowsiness, dizziness, behavioral changes. Contraindications: known allergy to the anticonvulsant. For fluids, for example, normal saline, to maintain hydration and electrolyte balance. Considerations: monitor fluid status and electrolytes, adjust infusion rate as needed. Side effects: fluid overload, electrolyte imbalances. Contraindications: severe hypernatremia, severe fluid overload.